You know, every medicine we take is supposed to help, right? But what happens when the very thing meant to heal us ends up causing harm instead? Today, we're diving deep into the world of adverse drug reactions, a really critical and often misunderstood part of medication safety.
So what does happen when a medicine makes you sick? It seems like a simple question, but trust me, the answer is anything but simple. We put a lot of trust in our prescriptions, but what happens when that trust gets shaken by an unexpected, harmful reaction? Let's investigate.
All right, to really get a handle on this, we're not going to start with some dry definition. Nope. We're going to start with a real-life medical mystery.
Okay, picture this. Our story starts with a 59-year-old guy. He's got some pretty standard stuff, diabetes, high blood pressure, and his doctor puts him on a new medication. For now, we'll just call it Drug X.
Now, here's the really important part. His liver is perfectly healthy. I mean, all his starting lab tests, totally normal. There are 0 red flags, none.
But then, just a month later, things go south, fast. He ends up in the hospital with some really scary symptoms. Jaundice, where his skin is turning yellow, he's incredibly nauseous, and his urine is dark. These are all huge warning signs that something is seriously wrong with his liver.
And the diagnosis? It's bad. Acute liver failure. His liver, which was totally fine just 4 weeks ago, is now literally shutting down. So, you've got a routine drug on one hand and a sudden, life-threatening illness on the other. What in the world went wrong here? Well, to solve this mystery, we first need to dig into the science behind what's happening.
So, let's decode the official language that doctors use to figure out what just happened to our patient.
Okay, so the official term for this is an adverse drug reaction, or ADR. And according to the World Health Organization, it's basically a harmful, unintended response to a drug that happens at a completely normal dose. Let me say that again. This is not an overdose. This is the drug causing harm even when you're taking it exactly as you're supposed to.
And get this isn't some rare fringe thing. Between 10 and 20%. That's right, 10 to 20% of all patients in the hospital experience an adverse drug reaction. That's a huge number, and it really shows you how common this problem is.
Okay, this diagram here is super helpful for getting the terms straight. Think of it like a target. That big outer circle, adverse event, is basically any bad thing that happens while you're on a drug. Then you move in a step to adverse drug event. That's harm caused by the drug, but it could include a mistake, like taking the wrong dose. But where we're focused is right in the bullseye, that purple circle, the ADR. That's harm caused by the drug itself when everything was done right.
So how on earth do doctors even begin to sort all this out? Well, they basically start by putting these reactions into 2 big buckets. You've got type A, which stands for augmented. Think of these as predictable. And then you have type B for bizarre. And yep, just like the name says, these are the weird, unpredictable ones that seem to come out of left field.
All right, first up, let's look at those predictable problems, the type A reactions.
Type A reactions. These are the ones that kind of make sense, They're directly related to what the drug is supposed to do, just more of it. They're also dose-dependent, which means a higher dose makes the reaction more likely or worse. A classic example is bleeding when you're on a blood thinner like warfarin, or feeling nauseous from chemotherapy. These are known, expected side effects that are tied directly to how the drug works.
Okay, now we're heading into the really weird territory, the type B reactions. This is where our medical mystery gets a whole lot deeper.
So these reactions have nothing to do with the drug's main purpose. They don't depend on the dose, and man, they can be incredibly serious. We're talking about allergic reactions, where your immune system just goes haywire, and something called idiosyncratic reactions. These are the ones that are truly baffling. They often come down to tiny, subtle genetic differences from person to person, which is exactly why they're so rare and almost impossible to predict in clinical trials.
Now, when we say allergic reactions, that's a whole complex rabbit hole of immunology. But for what we need to know, we can boil it down to 2 main timelines. You've got your immediate reactions. Think of a life-threatening anaphylactic shock from a penicillin allergy. It happens fast. But then you have delayed reactions. These can take hours, days, or even weeks to pop up, causing totally different problems like rashes or even damage to your cells.
Okay, so beyond A and B, there are a few other important types of reactions we need to know about. These ones are all about time, and what happens when a drug is stopped.
This chart here lays it out pretty clearly. Type C is for chronic. Think long-term damage.
like your kidneys taking a hit from using NSAIDs for years and years. Type D is delayed. This is stuff that shows up way after you stop the drug. The most heartbreaking example of this is the birth defects caused by the drug thalidomide. And finally, type E is for end of use. This is a withdrawal reaction, like having seizures if you suddenly stop taking an anti-epileptic medication.
All right, so with all that new knowledge, let's go back to our patient and finally solve this mystery. And more importantly, let's talk about what all of this means for your own safety.
So, the verdict. Our patient's reaction wasn't predictable. It wasn't related to the dose. It was a severe, totally unexpected attack on his liver. All signs point directly to a type B reaction, specifically a rare, idiosyncratic one. For some reason, unique to his own body's chemistry, that drug caused catastrophic damage.
And this, of course, raises a massive question. If these bizarre, unpredictable reactions can happen, how can we ever really know if a drug is safe? How do doctors and regulators weigh the good a drug can do against these kinds of potential risks?
Well, one of the key tools they use is something called the therapeutic index, which you can see in this graph. You can basically think of this as a drug's safety score. That green curve, that shows the dose where the drug actually starts working for most people. And the red curve, that's the dose where it starts to become toxic or harmful. That space right in the middle, that's the therapeutic window. And it's pretty simple. The wider that window, the safer the drug, because there's a much bigger margin for error between a dose that helps and a dose that hurts.
So, what does all of this mean for you? How do you keep yourself safe? It really boils down to 4 key things. Number 1, tell your doctor everything, your full medical history, every single past allergy. 2, take your meds exactly as prescribed. Don't ever change the dose on your own. 3, be aware of how your meds might interact with other drugs or even with certain foods. And number 4, and this one is absolutely crucial, if you notice any new or unusual symptoms, call your doctor immediately. Don't just wait and see.
And when patients and doctors actually report these reactions using forms just like this one, that information feeds into a huge global safety network. This data helps regulators spot dangerous patterns that they might have missed, and it can protect thousands, maybe millions of other people from having that same bad reaction. Your one experience can become a vital piece of a much, much bigger public health puzzle.
And that brings us to our final thought here. The next time you get a prescription, just take a second. Understanding that these reactions are possible empowers you to be an active partner in your own health, not just a passive patient. So the real question isn't just, what does this drug do? It's, am I asking the right questions to make sure it does it safely for me?